Hey everyone, my name is Matt Noble. I'm the founder and executive director at Toronto Vegetarian Food Bank. We're working on a new campaign called Put Food Banks Out of Business. It's a national campaign to urge all levels of government to work together to implement a guaranteed livable income to create an income floor in Canada based on the poverty line below which no Canadian can fall. In this interview, we're going to talk to Val Tarasuk, who's arguably the leading food insecurity researcher in Canada. When you hear that 6.9 million Canadians are food insecure, or that 1.8 million children in Canada live in food insecure households, you're probably hearing Val's work. But what is food insecurity exactly, and why are so many people impacted by it? In this interview, we'll unpack food insecurity, we'll talk about who's disproportionately affected by it and how it's a part of structural racism. We'll discuss why poverty is the real problem, the costs to our healthcare system, and why food charity and vouchers are not the answer. I really think you're gonna love this interview with Val. She's a wealth of information and she's amazing. And don't forget to check out putfoodbanksoutofbusiness.com to find out how you can help us eliminate poverty in Canada. Val Tarasuk's a professor emerita at the Department of Nutritional Sciences at the University of Toronto. Since 2011, she's run Proof, a research project that looks at how in Canada we can use policy to eliminate food insecurity to the best of our ability. A quick update. When we recorded this interview, 6.9 million Canadians were living in food insecure households, 1.8 million of whom were children. Since then, new food insecurity data has come out and things have gotten worse. 8.7 million Canadians now live in food insecure households, and Black and Indigenous people are still far more likely to be food insecure. A basic income has never been so important. Now here's the interview with Val. Okay, we're rolling. So just to get us started, food insecurity is a huge issue in Canada, but why don't you tell us a little bit about why you've dedicated your life to it and kind of why it's so important to you?
I mean, I've spent my career as a professor in nutritional sciences and and in the faculty of medicine at the University of Toronto, so there's an expectation that I do research. And when I started, it just seemed like the right thing to do was to work on a problem, right? And a problem that other people weren't really paying much attention to. And in the beginning, that was food banks, and then it evolved into this concept of household food insecurity. But I have kept working on it as a researcher over all these years because it's a big problem and it hasn't gotten any better. So the way that food insecurity is measured and monitored in Canada is through a very elaborate 18-item questionnaire. And what it's measuring is inadequate or insecure access to food due to financial constraints. So it's really picking up people that have got struggles to get enough food, to get the food that they need because of a lack of money to buy food. So that 6.9 million who are living in food insecure situations, the experience would range in severity from people living in places, in households where somebody's reported that they've worried about running out of food and not having money for more. But that's been the extent of the concern, on through to people who have compromised the quality of what they're eating because of a lack of money for food. And most importantly and most concerningly, people who have actually compromised the amount of food they've eaten because of a lack of money for food. So, skipping meals, going without meals, going hungry without eating, and at its most extreme, like those most extreme questions on that 18-item module are going whole days without eating, or your children going whole days without eating because of a lack of money for food. So the 6.9 million, it covers a range of experiences, but all of them are bad. And all of them are things that I think we should think of as unacceptable in an affluent country like ours.
How does defining it in the different ways help us understand the problem, but also maybe help us solve it?
Well, I think what we've learned as we've looked at the relationship between food insecurity and health, and also the relationship between food insecurity and public policy interventions, is that the severity matters. And people in more severe circumstances have much, much worse health outcomes. They're way, way, way more likely to end up in hospitals, to die prematurely, to, it's a very, very toxic condition to live in. So it matters from that perspective that we prioritize that condition, I think. The term food insecurity is a bit abstract, and people can see it to mean all kinds of things like food safety or the security of our food supply, given the war in Ukraine and disruptions in the global food system. But I think it's important that we talk about the experiences that people have that are the ones that are being counted in this head count, because those are experiences that are important and very, very damaging to people's health and well-being, but also experiences we can change.
And so with food insecurity, like you said, it's a bit of an abstract concept, but a large chunk of what food insecurity is correlated or is because of poverty. Not all of it, but a large part of it is just poverty, right?
Yeah. I mean, the way that most people in Canada acquire food is to buy it. And so to be compromising your food intake because you don't have enough food, invariably that boils down to you don't have enough money. And when we've scratched the surface and started to ask people that are food insecure, how are you doing otherwise? Like, how about your housing? Talk to us about your, the other aspects of your life. And invariably, someone who's struggling to afford the food they need is also struggling to pay their rent, or, to manage a mortgage if they got into the housing market. They're very, very likely to not be filling prescriptions as prescribed if they have prescription medications, and most of them will have because they've got poor health. They're likely to be compromising payments on things like cell phones, telecommunications, utility bills, all sorts of things. So we start by identifying people as food insecure through the lens of food, because that's a very sensitive indicator of how somebody's managing financially. But as soon as you scratch the surface, what you figure out is they're in a financially precarious circumstance. And one of its manifestations is food insecurity, but equally important are all these other things that are being missed in those households. So that's its link to poverty, I think, or it's linked to low income.
With our Put Food Banks Out of Business campaign, we're going to be advocating for, at minimum, an income floor below which no Canadian can fall. And that is going to be likely based on the market basket measure of poverty. And so food insecurity goes kind of like above and beyond that market basket measure of poverty. But I think we agree that at the very least, we need that income floor. So maybe you could talk a little bit about just that market basket, the importance, or just about that market basket measure income floor versus kind of how it fits in with food insecurity, but why that's like a basis that we need.
Yeah. The bottom has fallen out of our social safety net. And, when people become 65, they are entitled to an old age security and guaranteed income supplement if they're low income. And that gives them an income floor that is indexed to inflation. And, while many people will say it's not enough, it's substantial relative to living costs, and it protects most people from food insecurity at that point. We don't have anything like that for people who are working aged or for their families. So we find the really egregious situation of, for example, people on social assistance. Their incomes are most certainly below the market basket measure, so Canada's official measure of poverty. They're substantially below if they're on something like Ontario Works. And the probability of them being food insecure is very, very high. The rate of food insecurity amongst people dependent on social assistance in most parts of this country is over 70%. So they're almost certain to be food insecure. If we were to move to an income floor that was adequate to cover basic needs, those people's incomes would rise, and they'd have a fighting chance of being food secure. They don't have that right now. So similarly, we've got people in the workforce making small amounts of money, low-wage, precarious work, maybe working part-time, short-term contracts, and they're also very vulnerable to food insecurity. An income floor would get rid of that problem if the floor was set high enough that it actually covered basic living costs.
So a lot of people don't know that Ontario Works, as one example, is like the maximum someone can get is $733. So while you're saying people might argue that the amount that people get after retirement isn't enough, OW is less than half of that, and that is somewhat the trend. Like across the country, even though there's differences between the provinces. That's who we see a lot, is those people that are the people who are using the food bank are the people who are are severely food insecure, and those are often working age people, single individuals or single parents who are just being completely let down by our government and the social safety net.
Yeah, absolutely, absolutely.
It's so obvious that, like Ontario Works, what was the logic for the amount of money that sat there, right? It hasn't been indexed. It hasn't moved. I believe it's true. It hasn't moved since 2018. So we've seen extraordinary increases in food prices, but also the cost of rent. And what that means for somebody on Ontario Works is that they've become systematically poor. And like, the beautiful thing I think about the conversation that's starting to happen around basic income is talking about, the adequacy of incomes relative to true costs of living, and setting a floor that we won't let people fall below. We've walked away from that with what we're doing on things like welfare programs right now. And that's part of, I think, the reason we have such a big problem of severe food insecurity. I want to go back to something else in your initial question about the income and market basket measure story. We know that when we look at incomes in relationship to food insecurity, we can find people with incomes that are above the market basket measure, but they're still reporting food insecurity. I think part of what we're seeing in that picture are people with incomes that are moving around and that are unstable. And so they may have done okay at one point, but then they lost their job, or they lost their housing, and now they're in a situation that's much more expensive, and so the income that used to look adequate isn't anymore. I think setting an income floor would create a stability for people, even not just those whose incomes are currently below the market basket measure, but also for some of those that are near the market basket measure but above it, but who probably have got a fair bit of movement, a fluctuation in their incomes over time. And this would say, no matter what happens to you, we've got your back. We're going to make sure that there still is enough money for you actually to, feed yourself and your kids.
There are health issues that go along with every level of food insecurity, even though it's a spectrum. So there's a cost to food insecurity for people, and for people who are food insecure, and higher cost to taxpayers, the government. There's correlations with diabetes, exacerbated existing health problems, people foregoing medication, which translates into an increase in their use of healthcare, exacerbated mental health issues. Do you want to just speak to a couple of those problems to society, taxpayers, but also just the reality that is individuals who are suffering with that every day, like just getting sicker daily because they're poor? Yeah.
I mean, one of the most eye-opening things for me was when we finally got to a point where we could link the population survey data on food insecurity with health administrative records. So taking somebody's information about their food insecurity status over a 12-month period and linking it to their OHIP records. That was stunning when we started to see those associations, because we could see higher rates of healthcare utilization for everything: emergency departments, physician services, hospitals, home care services, like you name it. They were more likely to be using those services, therefore costing the system more. So when we looked at, like, for example, severe adults in severely food insecure households, so the ones that you're most likely to see in a food bank, they were burning up more than double the healthcare dollars of someone who was food secure just over a 12-month period. So it speaks to the cost, but it also speaks to the tremendous toll that food insecurity takes on people's health. Because, how do you end up in a hospital? We've got a healthcare system that is working very hard to make sure we don't, and everybody knows those are really, really costly things. But so by the time we find somebody who's food insecure, who's been hospitalized for reasons of mental health, for example, which is way more likely to happen for someone who's food insecure, particularly if they're severely so, than anybody else in this province, we're talking about someone who's really, really derailed in a serious way from a health perspective to warrant an admission, right? So our learnings about health, I think, tell us two things. One, that this problem is serious. This isn't just about somebody missing the odd meal or, whining because they can't get the food they really want because they're low income. This is about people whose lives are seriously compromised. The other learning is this costs the system money. It is not without cost to have 6.9 million Canadians living in food insecure situations. If for no other reason, we should care about this because we've got a modifiable drain on our healthcare system in the form of food insecurity.
And I want to talk about health and the costs a little bit more, but I just want to finish up on, we talked about how the different levels of food insecurity, moderate, marginal, severe, and that people using or receiving social assistance are often represented there. But one of the really stark findings in the data is that Black and Indigenous households in Canada are twice as likely to be food insecure compared to their white counterparts.
Right.
Like that.
Yeah.
That's just horrible.
Yeah.
And even after we take into account other things, like we know, for example, that, food insecurity is more common amongst people who are not seniors. It's more common amongst people who are renting as opposed to homeowners, or people who are unemployed, or on social assistance. All those other kinds of demographic characteristics, even after we take those things into account, we can still see a very, very strong association between the likelihood of being food insecure and being Black or Indigenous. So sadly, I think those findings speak to the impact of systemic racism and colonization, the legacy of colonialism that manifests among other ways in the form of higher rates of food insecurity amongst those two particular population subgroups. Like almost 4 out of 10 Black or Indigenous people in Canada are food insecure. Like that's almost half.
Yeah.
And again, this is a problem that, it's been documented for a few years now, but we're not seeing anybody doing anything about it. So the trends aren't being reversed. And when you think about the conversation we've just been having about the health implications of this experience, what are we doing? Further disadvantaging groups that are already discriminated against and have, histories of disadvantage.
There's a cycle of poverty, and there's a cycle of privilege, and this situation of the racialization and other groups as well of food insecurity. It can trap people in that cycle. So can you speak a little bit to how this aspect of poverty being an aspect of structural racism, how that actually perpetuates poverty and inequality and keeps people in poverty?
Yeah.
Well, I mean, one example, and I don't know if this is what you had in mind or not, but one example is just to think about children in these settings. Because we've got, again, very, very compelling evidence in Canada that children living in circumstances, especially where they've been exposed to severe food insecurity as children, they're more likely to develop depression, asthma, other sorts of health problems that are significant and that they will be managing for the rest of their lives. And so the system we've got right now that exposes so many working-aged adults and their families to food insecurity, and particularly severe food insecurity, that leaves an indelible mark on the children who grew up in those households, and it will disadvantage them going forward. From a health perspective, the same studies that have shown us the relationships with mental health disorders amongst children have also documented, less likelihood of completing high school, a higher likelihood of young women in those settings giving birth earlier. So other indicators that the life chances of children who've grown up in these settings are diminished.
Because people from marginalized groups end up food insecure and in poverty more often than their white counterparts, I often think that basic income could have a bit of a reparatory effect. It's not like a silver bullet, but could you speak to how a targeted income support would have a disproportionately positive effect on these groups?
Well, I would hope it would have a disproportionately positive impact because it would be accessible, and if we had the basic income of our dreams, I think it would be an entitlement. It wouldn't be something you had to qualify for or argue for or appeal for, that it would be something that was your right. in the same way that, in doing that, in the same way that healthcare is our right kind of thing, we would make food a right. Basic income would give us a right to a basic standard of living. And I think part of the ways in which structural racism plays out in our society right now is that there are lots of ways in which the allocation of privilege is contingent, right? So discrimination plays out in our education system, in our employment system, in our housing market system, and something that's working as an entitlement should pull us away from some of that, right? Which is what we'd hope that basic income would be.
And so there's obviously would be benefits to people experiencing poverty and food insecurity, but what about society, like as a whole? Like if it's something like this, what are some possible benefits to the country or all of society from lifting people out of poverty?
I know that there will be costs associated with implementing a basic income. And for sure, many people have talked about how that makes this a bad idea because it's simply unaffordable. But we would hope that the investment in an income floor would be offset by the savings in things like our healthcare budgets. At least to some extent, those things should balance out, and we should have a more productive, healthy population. And at the end of the day, that should be the benefit for all of us. I mean, nobody should want to be in a society where there's so much inequality, because it's bad for all of us, right? We're locking our doors. We're afraid of each other. We're battling the conversations that are going on now around violence on transit systems and people on transit systems because they don't have anywhere to live, and we've got a lot of problems right now that we're wrestling to manage that are in part rooted in abject poverty, right? Our failure to look after each other properly. So I think there's a lot of little I don't mean to diminish those problems, but I think there are a lot of bits and bats going on all the time in our communities right now that would be more easily addressed if we had an income floor and we gave people a fighting chance to manage independently.
In terms of just talking about the philosophy and how we think of each other in society and just wanting each other to be okay and not have our neighbors and family and friends and just people in our country be poor, we have to address that sometimes it comes up, this silly question of people being concerned that people are going to go out there and spend their money on cigarettes and alcohol. How do you respond to they're going to go blow on all their money question?
Over the years and proof that we've done studies looking at policy interventions in Canada where there's been, the introduction of the Canada Child Benefit, the implementation of the Ontario Child Benefit, the increases in social assistance that happened in the early 2000s in Newfoundland and Labrador. I mean, there have been many instances where we've had an opportunity to look at what happens to food insecurity when a province or a federal government introduces something that gives a small boost to the incomes of low-income people. What have we found? Every single time we've been able to create an analytic design to look at that, we found that food insecurity reduces. If we took food insecure people and we gave them a bit more money and what they did was spend it on cigarettes and alcohol, food insecurity wouldn't have changed, right? But take the example of the Canada Child Benefit. When it was introduced, we saw a decrease in severe food insecurity amongst low-income families with children by about 33%. So severe food insecurity, that means we had families with children who were reporting not having enough to eat at times because of a lack of money for food. The Canada Child Benefit came along. It maybe played out to be about $1,000 or $2,000 per year more new money for those families. And for some of them, there was a reduction in the likelihood of them being severely food insecure. That could only have happened because that new money got spent on food. So I think, and I mean, I know that's an elaborate, example, but I think there are many, many more like that say, we know what happens when we give people that are dirt poor more money. They spend it on essentials. We've seen that time and time again. My example of the Canada Child Benefit from a severe food insecurity perspective is one of them, but there would be dozens of other examples. So it's simply the argument, we can't trust people to spend their money properly. Well, people aren't food insecure because they're spending their money poorly. They're food insecure because they don't have enough money.
And in theory, if we're giving people the benefit of the doubt, they're asking about people buying cigarettes and alcohol because we're hoping they care about people, right?
Exactly.
And the data shows us that if people are lifted out of poverty or food insecurity, they get healthier.
Yeah,
right?
that's right. That's right. They absolutely get healthier. And I mean, we don't have anything to say that people who are food insecure right now are making poorer choices, just that they are less able to make good choices, right? Yeah.
And that's part of the cycle of poverty.
Yep.
Can you just talk a little bit more just about the general health implications of food insecurity? Maybe we can talk about health a little bit more and just the general impact on people's health, physical, mental.
Okay.
We can see relationships between food insecurity and both physical and mental health problems. When we started studying food insecurity way back in the 90s, the thinking was that it was primarily a problem of food, and so the associations would be with things that were diet related. So the expectation was that we'd see higher rates of diabetes, for example, amongst food insecure people, or high blood pressure or heart disease, things that were associated with poor quality dietary intakes. Yes, we can see those associations, but the strongest associations by the long shot aren't the diet-related conditions. They're the broad spectrum conditions, but also mental health problems. We have very, very high rates of mood and anxiety disorders amongst people who are food insecure. And there's good data to suggest that being food insecure puts a huge amount of stress on people, especially parents, and that they're more likely then to develop mental health problems and they're less able to manage them. So at one point we did a calculation in Ontario, and almost 40% of adults in Ontario, working-aged adults that were being treated for reasons of mental health were from food insecure situations. Like, they're almost half. And it's because the intersection of mental illness and food insecurity is so strong. So mental health problems, also the things you'd expect, like cardiometabolic conditions. The other thing we can see is higher rates of premature mortality. Again, a study we did a couple of years ago, we figured out that amongst adults, food insecurity was cleaving on average something like 9 years off life. And we can see that the mortality, when we look at what are the causes of death, adults in food insecure situations are more likely to die of just about everything except cancer, to be frank. So they have higher rates of death from heart disease and other sorts of metabolic disorders, but also higher rates of death related to injury, to suicide, poisonings, drug poisonings. The whole gamut of causes of death, everything except cancer. Cancer appears to be the great leveler in our society. That is, but everything else, we can see higher rates of premature mortality amongst adults who are food insecure.
And that's one of the points that really stood out to me as someone who's severely food insecure. Likely people who are using food banks are on average likely to die 9 years earlier than someone in Canada who's
food secure.
Yeah, and
but that's a huge number, right?
9's a huge number. Yeah, we should be emphasizing this, right?
Yeah, like that's like,
it shouldn't be just passing in this conversation.
No, like what else is there that we would talk about like this? That's a kind of a social problem that is doing such damage that we can pick up a difference of 9 years. Like it just blows me away. To be a female-headed lone parent family is a very bad thing, right? The probability of being food insecure for women who are lone parents is very high. I think it's somewhere around 40% right now of women in those circumstances, or families that are headed by a woman, are food insecure.
I remember creating a graphic for a post a few years ago that just said, like, in Canada, 1 in 3 single mothers are food insecure, and you're saying 40%, so that's like more than 1 in 3, which is like, that's another number that's really hard to wrap your head around, right? One in, like, as I was, I might have gotten the numbers like from crunching numbers from Proof Report, or maybe I got that right from you, but like as I was writing it and like posting it, I was like disbelieving myself. I was like, how could this be a number? How can 1 in 3 single mothers in Canada be food insecure?
I know. You know, there are so many ways in which we are not taking that piece of information and working with it. And if I think, for example, of the Canada Child Benefit, you know, we're not doing anything to give a little extra boost to single parents. And we should be, because they're so much more vulnerable. And that has to be about income, but also about their inability to ever, you know, acquire savings, to have assets that you know, buffer them on a rainy day. You know, there have to be ways in which, knowing what we know, which is this well-established fact that to be a female-headed single parent family is to be at very high risk of food insecurity. Knowing that, like, what are we doing about it? You know, like, that's a very identifiable group. Why don't we reach out and provide a bit more support to those families?
The 9-year mortality difference is huge, but that's averages, right? That's the average of the food. That's the averages of the severely food insecure and the average of the not food insecure. But in their book, A Basic Income for Canadians by Evelyn Forget, she actually cites data from a town or a city in Manitoba, where the difference between the wealthiest neighborhood, the average in the wealthiest neighborhood and the average in the poorest neighborhood for men and women is an over 15-year difference. So if 9 seems high, when you start talking about the wealthiest and the poorest, it gets even.
It would be much
worse.
Bigger.
And since we're talking about Manitoba, Leah Gazan, who's the member of Parliament for Winnipeg Centre, she has said that a conservative estimate of the cost of food insecurity to our healthcare system in Canada is at least $7.6 billion. Why don't we talk a little bit about why food charity is not the answer. With my work at the food bank, but also within like the animal protection movement, a lot of people in these spaces tend to want to take and sure, it's called food insecurity, so it's easy to you know, get confused or to get lost in the nuance or the complexity of that. But a lot of people take poverty and they want to figure out, how can we help people? They have great intentions, like they want to really get to the bottom of it and figure out how to help people, but they tend to make it about food as opposed to lifting people out of poverty. Can you speak to that kind of like how it absolutely doesn't have to be about food?
Going back to what I said earlier, that we identify people as food insecure through the lens of food. And if you think about a food bank, you know, it's a very visible manifestation of somebody using a food bank. It's a very visible manifestation of them struggling to afford the food they need. But as soon as we scratch the surface, we figure out, well, these people are struggling to afford everything because, you know, many of them, particularly people using food banks, they're on Ontario Works, they simply don't have enough money. And so we start by identifying a problem or people struggling through the lens of food, but we're fools to stop there. And I mean, that's part of the problem with the fixation on, well, we just need to get more food for these people. I'm thinking, well, you know, you actually can't get enough food for these people because they don't just need food. Like they also need help with rent and with all kinds of other expenditures. So food's never going to fix these problems because it's only one part of the need, let alone, you know, the fact that it's not dealing with the root causes of the need. One of the terrible things I think about charity, and Canada is special in the way that we've entrenched this massive food charity system. One of the things about food as charity is that anything goes. You know, you give somebody some food and you think, hey, I've given them food. I've done something really great. And, you know, it's taken a lot of work to raise the money or to collect the food, the donations you needed to give people that food. And you think, well, this is a massive undertaking, a major achievement now that we've moved this food. And so often the activity of giving food to people is measured in terms of the number of hampers that are given out, the number of thousands of pounds of food that are distributed, or the number of people who visited the service. Well, none of those metrics take into account the need. People need food 365 days of the year, you know, that 3 meals a day would be good. And, you know, it's a huge number. And if we ever took these gestures, these charitable gestures of food charity or the collection of money for a little voucher program, if we ever put those activities as a ratio of the denominator, which is need, we'd realize that we're talking about a drop in the bucket. And to do more than that would be overwhelming, right? I mean, look at all the people in this country that are working flat out now just to distribute the amount of charity that we're doing. And we're constantly hearing reports of food bank numbers going through the roof, people being overwhelmed, soliciting more and more donations. But, it only seems like a massive undertaking until you put the denominator under it, and then you realize that it's paltry. And so, I think we just have to accept that the fact that there's all this chatter about, how can we help? What can we do? Let's hold a food drive. Let's collect some, donations on our street or whatever. All of that speaks to a beautiful Canadian value, which is that, people care about other people in their midst going hungry and they don't want to see that. And if they can think of something to do, they'll give it a shot. Wonderful, beautiful, beautiful Canadian value. We should all be very proud of it. But somehow we've got to shift the conversation to say, look, if that's your value, then support some public policies that put an end to this.
As someone who runs a food bank, I can tell you that food charity is highly inefficient. Yeah. And it's kind of funny because when people reach out to me about making like food donations, I often say like, just give us cash. Because it's much more efficient. You don't have to run around and do stuff. We don't have to sort stuff. Just give us cash because we know what we want to buy. But what we're trying to do with the Put Food Banks Out of Business campaign is actually say, don't even give us cash, just start advocating for policies to give poor people cash. Cut us out too. That's inefficient as well. It's inefficient for people to give us food. It's more efficient for people to give us money, but it's also just inefficient to pass all that through a food bank so that we're giving people food. And you've actually done research on food banks. And so you have said in the past that food banks don't solve food insecurity, and you've also said that there's no evidence that income supports need to be tied to food at all.
That's right. Well, we have no evidence that people's inability to afford the food they need is related to them not allocating enough of their budget to food. So there's nothing to suggest. I mean, often people will say, oh, what about food stamps? Why don't we follow the model of some other country, food prescriptions, food vouchers, food whatever, to make sure that the money goes to food. We have nothing to say that that's necessary, and certainly nothing to say that it would be an efficient way to administer assistance. What people need is enough money to meet basic needs. And to parcel that out into, here's a little coupon to buy this thing, here's a little thing to buy that, like to try to micromanage people's needs by tying each one of these allocations of resources to some particular, worthy good is just it's unnecessary, it's inefficient, and it's very unlikely to be successful.
It's paternalistic. It speaks in a way, it echoes the aren't people going to spend their money on cigarettes and
totally.
alcohol thing,
100%.
because it's trying to give people food stamps is just a way of it's not saying, but what it is saying, even though it's not explicitly saying, is that we don't trust people to take care of themselves and know how to take care of themselves when they're struggling with poverty. We want to control the way in which they take care of themselves. And so that's like paternalistic. And given the demographics of who's food insecure, saying paternalistic might be putting it lightly.
Yeah. Absolutely. Yeah, well said. One of the things that probably is worth flagging is, we get this idea of food stamps from the United States, but when you look at the history of food stamps in the United States, they don't have that program because they've got research in the States that says, oh, we really need to tie income supports to food spending because otherwise people won't spend their money properly. That's not how this came about. That program, its origins was a commodity surplus program. It was about providing support, monetary support, to farmers in the United States at a particular time in history when they had commodity surpluses. So the reason it started out as food stamps was as a way to funnel money to a particular group of not food insecure people who were, big agricultural producers that, at that time were lacking a market. they've got food stamps now because of the legacy. It's a legacy program from a time when it was a clever initiative to support farmers during a particular period in history. So, we've got to put these things in perspective.
That's where the term from the States, government cheese, comes from.
That's right.
Right?
That's right. That's right.
We had the grocery rebate recently, which was a cash transfer, and it was called the grocery rebate, but it wasn't directly tied to food. So, I mean, a lot of people are saying that that's a good step in the right direction.
Yeah. What was good about that? I mean, we know food prices have risen dramatically, and the numbers of people who are seeking, charitable food assistance have risen. The number of people living in food insecure households has risen. I mean, there's many indicators that we've got growth and vulnerability in the Canadian population right now. So I think it was very positive that the federal government issued this thing that they called the grocery rebate, but in fact was an enrichment to the GST credit, a tax credit that's been around for a while. And what's beautiful about it is it's targeted towards low-income households. So, whether you get the GST credit or not depends on your income from the prior tax year. So it was targeted so the assistance was going to people that would have been struggling because they were lower income, and it came as a check.
It was a good example of something that wasn't enough, but a step in the right direction. Yeah. And it was income tested, yep. So it really fits into a piece of the pie of how we would cobble together a basic income.
Absolutely, yeah.
Right?
And from that perspective, it's very, very positive, right?
Mm-hmm. And just to finish up on the conversation about sort of food charity, but this is a little bit different, but something that's kind of like people are talking about, especially in the health community these days, is food prescriptions.
Who gets the food prescription? And it would only be someone who was sick enough to see a doctor and to qualify. And typically these food prescriptions have been focused on things like diabetes. So finding adults that are with type 2 diabetes that's out of control or being poorly managed. And so, we give them a food prescription so they're able to get healthier food that perhaps then causes them to be able to manage their diabetes better. But what are we doing? We're allocating a small resource through a very overstretched healthcare system for some sick people who are poor and food insecure. How long does it last? How much do we give them? The probability of the food prescription having an impact on those people's health will be a direct function of exactly that, how much they get and how long they get it for. The rest of their lives would be ideal, mm-hmm. and as much as they can possibly need, because, the whole point would be to try to reverse their health trajectory, which is rooted in their inability to afford basic needs now. So, it's a little naive, I think, to think that we can fix this problem with that response, because invariably they're under-resourced. So far, the food prescription programs we've seen in Canada have been time limited. So, you qualify for a while. You have to be sick to even qualify. So we don't try to prevent you from getting sick. We mm-hmm. wait till your diabetes is out of control before we do this, as opposed to, figuring out that you're at risk of diabetes by virtue of being food insecure. And so we're going to try to keep you healthy and not have you develop type 2 diabetes. So, there's a lot about this that I think is mixed up. And it's concerning that it's a medicalizing of food and food needs, but also that it is so unlikely to be able to do the very thing that people aspire to do, which is to reverse the health disadvantage associated with being food insecure.
We basically are talking about how food prescriptions are actually in a way worse than food vouchers, because at least food vouchers are going to people when they're poor and are on some level more preventative. But so even though we know vouchers are not the best way to deal with this, food prescriptions might even be worse.
Well, I mean,
in that sense,
they're worse in the sense that they're tying up the resources of our healthcare system, and they're setting the expectation that somehow someone's health will improve as a result of this fairly trivial infusion of resource. Whereas, the vouchers, if they're administered in a community setting, perhaps they're more widely received, and also perhaps they're more accessible to people, because you know, if the only person who ever gets a food prescription is the one that actually has the doctor's appointment with the doctor who happens to be tied into a prescription program and happens to screen them that day and not be too busy to do that, like, you know, it's a pretty elite group we're talking about, as opposed to, you know, the people that could walk through the door of a food charity operation or a community center, and maybe with different hours and, you know, different opportunities.
Isn't there a dietitian group that actually supports a basic income?
Yes.
There is a group in Ontario called Ontario Dietitians for Public Health, and they have been really, really strong advocates for systemic solutions to food insecurity. And it's neat that they are, because if you think about who they are, they're dietitians working in public health units. Often they've worked in a community health center or something like that. And the expectation has been that they would do nutrition education, that they would lead cooking classes, or, you know, start up community gardens, or that they would be the arm of our healthcare system that would work with people that were struggling to put food on the table, to give them the skills to be able to do that. And the dietitians who've been put in those roles, it takes them very little time to figure out that they're beating their head against a brick wall, that, you know, people are coming in with no money, and these little educational initiatives just simply aren't enough to reverse that. So I think it's really wonderful that they've come together to do something more proactive and more upstream, to say, like, we know that our little, you know, nutrition education initiatives aren't enough to fix this. We know that firsthand, and we've got careers of that. We want to see systemic change. And so, yeah, they're very, very strong advocates right now for a basic income. One of the things that they're doing that I think is really, really important to this conversation, they're the group, or they're the profession that do the work around costing food, calculating the cost of a nutritious food basket. And so they create a benchmark. And not that the nutritious food basket is perfect or whatever, but that it gives us some kind of objective indicator of how much does somebody need to actually meet their food needs and their shelter needs. And so across this province and many other provinces, we've got public health nutritionists doing the arithmetic for us and saying, well, here's what we estimate to be a rough cost of an economical but low cost diet. How do, you know, now we're going to add in the, you know, average shelter cost in our area for a 1-bedroom apartment or whatever. How does that compare to minimum wage or Ontario Works or Ontario Disability Support Program? And it's really, I mean, it's really helpful, because it renders transparent the inadequacy of some of those basic income programs, or not, I don't mean to, some of those income support programs. It renders transparent the absolute futility of somebody trying to manage on those incomes.
You're saying OW, welfare,
Yep.
and disability, like those,
Yep.
you're saying it points to the inadequacy
Yep.
of
Yep.
how much money people
Yep.
get, because it is so low. When you think about it, it seems like a no-brainer that people who are trained to advocate for healthy diets, or people maximizing health through food and diet, it seems like a no-brainer to realize, to even start that conversation, people need food in the first place.
Yeah, it's very appropriate that they're taking that role on, but I think we in Ontario are really fortunate that there's a critical mass of public health dietitians doing this.
We've touched on the protective effects of when people hit retirement, and a lot of that research has been done by Lynn McIntyre.
Yes.
And maybe just as we're like kind of closing up, you could talk a little bit about just that protective effect, and that is a really good example of a protective effect, and maybe some of Lynn's work that shows us that.
Yeah.
Well, I mean, Lynn McIntyre, a very, you know, distinguished Canadian, right, who's done a lot of really important research in this whole area of food insecurity. And so one of this, a body of work that she and a colleague of hers at the University of Calgary at the time, Herb Emery, one of the things that they did was look at food insecurity amongst low-income unattached adults as they approach 65 and then after. And it's such a powerful study, because they looked at the rates of food insecurity. So they looked at specifically at people at that time with incomes below 20,000 and unattached. So there was no question that their likelihood of being food insecure would be impacted by spousal benefits or anything. So before they hit 65, the main source of income of these people would have been social assistance or low-waged employment, but very low-waged, right? Because we're talking about a very low income. So most of the adults in this cohort were on social assistance programs. The rate of food insecurity amongst that group, I think, was somewhere upwards of 40%. when they hit 65, still low income, unattached adults, but now the probability of food insecurity dropped in half. And nothing else had changed, except that now the main source of income was public pensions. But to transition from something like Ontario Works to old age security and the guaranteed income supplement, that means that your income will have more than doubled. Mm-hmm. And with that, boom, the probability of food insecurity plummeted. Now, it didn't hit zero, and we can talk about why that might be, and maybe the old age security and GIS needed to be higher, but still the profound drop in the likelihood of food insecurity for adults simply by hitting 65 and having a secure income that was indexed to inflation, which again, Ontario Works isn't, but a secure income that was indexed to inflation and had some relationship to costs of living. I think it's a very powerful model of what a basic income could achieve for us. Tragic flip side of this is that we talked earlier about the relationship between food insecurity and premature mortality. So after Lynn McIntyre and Herb Emery had done this stellar piece of work looking at the effect of public pensions on food insecurity rates, we went back to the mortality data and we said, what's the likelihood of somebody who's food insecure hitting 65? And you can guess the answer, right? Not much, especially if they're severely food insecure. So the tragic part of this is wonderful if you can actually make it to 65, your life will get a lot easier. And if you can make it to 75, wow, will your life get good. But the probability of someone who spent the last 65 years struggling to put food on the table for themselves and their kids, the probability of them actually making it to 65, let alone 75, is low. Yeah.
We're really not taking care of each other very well.
No.
I think another thing we could touch on quickly is the Canadian Child Benefit.
Good.
Don't want to leave that behind because it's also
topic,
it's also something good to chat about, because when the Liberals first, or when the government first raised it, they had figures, I don't remember what they are exactly, but about how many children that lifted out of poverty.
That's right.
But and that's great. That was great, but I think since it's gotten worse again. So can you kind of speak to how we can think about that in terms of like a basic income or income supports for those who need it the most?
Yeah.
I think it's true that it's over 95% of Canadian families receive some check from the Canada Child Benefit. And for those, we're talking then about people with incomes over $200,000. And their check may be small, but they're getting a check. So while often the federal government will talk about this as a poverty reduction strategy, the truth is that most of the money that is allocated from our federal coffers for the Canada Child Benefit doesn't go to people living in poverty, it goes to the rest of us. Okay, so what's it doing about food insecurity? Well, we've got the maximum benefit being received by households with adjusted net incomes somewhere under 30-something thousand. The maximum amount that they would receive for a child under the age of 6 is around $7,000. And once the child hits 6, that benefit drops by $1,000 to around $6,000. And then that lasts until the child turns 18. So sometimes people have talked about the Canada Child Benefit as a basic income for children. So we've got the seniors, the public pensions for seniors, and then we've got the child benefit for children. But the difference between those two things is day and night, because $7,000 isn't enough for a child to survive for 12 months, right? I don't know what the calculation ever was based on for the amounts of the Canada Child Benefit, but the maximal amounts are not enough to make any sense if we look at them in relationship to the cost of food for a child, the cost of clothing, transportation, the need to rent a bedroom, a house with an extra bedroom for that child. There's no way these amounts make any sense against the actual costs. So then what are they based on? I don't know. When we look at how they relate to food insecurity, it's not good. We can see, I mentioned earlier, a small decrease in the probability of severe food insecurity amongst low-income families when this benefit was first introduced. But as we move forward in time, we continue to see extremely high rates of food insecurity amongst families with children. In the most recent data we've got, I think it's almost 1 in 4 children under the age of 18 in Canada living in a food insecure household. So the rates are not only are they not going down, they're going up in the face of the Canada Child Benefit. It's indexed to inflation, fine, But the benefit amount itself for the lower income families is simply not enough. We talked earlier about single parent female-led families. Very, very high rates of food insecurity for those families. That the differential between single parent families and two parent families doesn't change when we take into account the effect of the Canada Child Benefit for them. Still, the single parent family is way more vulnerable. Why aren't we giving them more? We could make improvements to the Canada Child Benefit cost neutral simply by taking the benefit away from very high income families. And I don't understand why that isn't a conversation. Like over and over again, we hear people saying, oh, we can't afford these things that you're asking for. I'm thinking, well, how can we afford to be sending the Canada Child Benefit to high income families? Like, what's that about?
People who are single individuals or single parents have just really been left behind. So do you want to say anything else about just the importance of that group, of focusing on that group?
I think it's critical that we focus on them, and it's tragic that we haven't, because there's a way in which our conversations about seniors or children are really us going back to the deserving poor, right? And we have a lot of people that are single individuals, and they are extremely vulnerable to food insecurity, and and they're costing our healthcare system the same way as somebody who's in a couple, and a single parent. We need a more equitable approach to income support, and sadly, right now, our fixation on seniors and children, it really is taking us into a place of deservedness, right? Mm. The most egregious example of that is what we're doing with what's classed as single employables on social assistance, with these income support levels that are blatantly insufficient to cover costs. And what do we expect that to achieve, right?
Like welfare rates.
Yeah, that's right.
They're punitive, and how do you expect anyone to get out of poverty when all they have is $700 a month for a room? Yeah. Or
how do you expect them to even maintain housing, right? I mean, we constantly have these ridiculous conversations about homelessness and silly little bylaws about panhandling or something, and when will somebody make the connection between our problems of homelessness and the blatant inadequacy of something like Ontario Works to cover basic shelter and food costs? Because we make it impossible for people to maintain housing even, let alone meet food needs. I mean, it's no accident that most of the clientele in food banks, and certainly the clientele that food banks report coming week after week after week, is people on Ontario Works. What else can they possibly do?
With a history of decades of food charity, food banks being present for about the last 42 45 years, and in the presence of a constantly growing food charity sector, and the government constantly giving money to food charity, food insecurities continued to get worse over those 4 decades.
What we're doing isn't working. People like me continue to do studies that show these horrible health outcomes and extraordinary healthcare costs, and if we have enough data, we follow children over time and find that they're not doing well either, and they're more likely to turn up in our mental health care system. When do we stop and say, wait a minute, this isn't working, we got to get off this? If we're not prepared to contemplate a new way in something like a universal basic income, if we're not prepared to take on that vision, then what we have to do is go back to basics and open up the textbook on all the fragmented social, federal and provincial and municipal programs we've got, and start trying to bring them back on track so that together they enable someone to cobble together basic needs. And to me, that's an overwhelming undertaking. The basic income seems like a much more straightforward way to approach this problem. But if we're not prepared to go that route, then we have no choice but to start to open up this gigantic mess of, fragmented, piecemeal approaches with a whole bunch of infrastructure at the front end to establish who gets what when, and maintain it and track it and whatever. It's gigantic, right?
The evidence also shows us what we know does work.
Yep, that's right.
Which is just lifting people out of poverty.
Yep.
Right?
And with these fragmented approaches, there's no accountability. So we've talked about Ontario Works. Nobody has to answer for the fact that that amount of money is inadequate. Like there's no legislation that says it has to be adequate. You know, that was repealed several decades ago. There's nothing, right? So that's okay. The Canada Child Benefit, I continue to puzzle over where these numbers came from, these amounts, what were they supposed to buy? And again, there's no accountability, right? And I think what we want with a basic income is transparency, to say this amount of money actually could enable somebody to meet basic needs. And we don't have that. The closest we've got to that kind of transparency right now is the way that we scrutinize our public pension system. But we don't have anything else. Employment insurance, like what are those numbers based on? They don't link to any real cost of living. You know, no wonder if we ever find households who are solely reliant on employment insurance, heaven help them, they're very, very likely to be food insecure because that amount of money will be insufficient. So the absence of accountability for the existing hodgepodge of social programs is part of what's gotten us here.
And I also think a problem with opening up all the different programs and saying, can we do better on this piece and do better on this piece, is we're constantly at the whim of the next government.
That's right.
Right? A next government's going to come into power. It could be Liberal. It could be Conservative. It could be NDP. And so policy lurch could be a huge obstacle to this complicated, long process of opening things up. But also, you would think, with the aspects of basic income, of alleviating poverty, of choice, of freedom, of all of these things, that every ideal that all of the parties from left to right agree on or disagree on, they still agree on a basic income.
That's right. They should all be able to get behind this. Yeah. Absolutely. Yeah.
So it seems like a no-brainer.
Except that then we get the skeptics coming back saying, oh, it's going to cost too much money, or it's going to be a disincentive to work. And those are the two, it seems like those are the two big arguments. It's way too expensive and it's going to cost too much money. And I'm thinking, you know, or it's going to be a disincentive to work. And, you know, I don't know that either one of those is true, or even if it is, for me personally, it's not a compelling argument against a basic income.
There are studies out there that show that that isn't the case. I think Evelyn Forget's work on Mincome shows that isn't the case, and the people who weren't working were either like staying home with children or going back to school, which is better for society too, right? Like it. So as someone who's saying like maybe but people aren't going to work, actually that person might go back to school and benefit society. Right? So.
Well, and remember, when it comes to food insecurity, most of the people in Canada that are food insecure right now are in the workforce. You know, if people are really concerned about that, they can take the umpteen invitations that they've had to start some pilot projects, figure out how to make it work. You know, I mean, we've got Prince Edward Island wanting to be a test case for a basic income. We've got, you know, Ontario having at one point had a pilot running. There's no shortage. We've got an all-party committee in Newfoundland and Labrador looking at the question of a basic income for that province. So we have no shortage of jurisdictions wanting to come forward and say, you know, use us as your test case to figure out how to make this work.
Why don't you tell people watching where they can find all of your great work?
Okay. If you simply Google Proof Food Insecurity, PROOF, you will get to our website. And if you get to our website, you'll see all kinds of things. We have a whole lot of very colorful graphics on the state of food insecurity in Canada. You can find also some fact sheets and infographics around things like the relationship between food insecurity and health, or the relationship between food insecurity and charity. Throughout this conversation, I've made reference to a whole lot of studies around food insecurity, in particular public policy interventions. That information also is on our website, so please check it out.
And when you're done checking out Proof, go check out putfoodbanksoutofbusiness.com to learn more about how you can help eliminate poverty in Canada.